Good morning. Around the world, there are now more than 11.6 million cases of COVID-19, and in Canada, more than 105,000 cases. This week, there was a record number of cases reported worldwide in one day, with more than 212,000 cases on July 4th. The World Health Organization has warned that the virus is still on the upswing around the world. 60% of the total cases of COVID-19 have been reported in the last month. Over the last week, there has been a 7% increase in cases in Canada compared to the previous 7 days. And the number of cases in young people, aged 20 to 29, is the group that is increasing. I'm happy to report that there are no new cases of COVID-19 in P.E.I. today. We currently have 5 active cases of COVID-19 in the province, and all are at home and doing well. All close contacts of the cluster of cases have tested negative. All cases and their contacts are self-isolating for 14 days and will be followed up daily by public health. All the residents, staff, and visitors of Whisperwood Villa who have been tested have received negative results. And there are still a number of visitors to be tested, but there are very few of those who remain to be tested. And all those visitors who have been tested are negative. Residents, staff, and visitors will be retested, and those tests will begin tomorrow. There are some questions about the definition of community spread. And I want to clarify that the cluster of 4 cases over the weekend, we have identified a probable source of infection for each of those cases with no evidence of widespread community transmission. As always, I urge all islanders to follow public health measures and stick to the basics. Please keep your circle of contacts small and practice good hygiene measures. Do not go to work if you are feeling unwell, and call 811 or your family physician if you have any symptoms of COVID-19. We know the more closely you interact with others and the longer the interaction, the higher the risk of COVID-19 spread. Our system responded well when it was discovered that there were new cases of COVID-19 in our community, and we were able to do everything that needed to be done to mitigate the spread of COVID-19 in the province. We could not have asked for better cooperation among our many partners: acute care, Island EMS, public health, long-term care, testing clinics, primary care, and thank you to all involved. The QEH lab processed 852 COVID-19 tests over the weekend, which is a record number. A special thanks to the staff who worked diligently to carry out this work. The international evidence on the effectiveness of face masks and face coverings has evolved during this pandemic. And given the evidence that we know and current understanding, we know that masks are effective in limiting the spread of COVID-19 and serve to protect others around us. Some people with COVID-19 do not have symptoms, adding further support to the need for people to wear masks. We know the number of cases of COVID-19 is still on the rise worldwide. Up to this point, it has been my recommendation to consider wearing a non-medical mask in places where physical distance of 6 feet cannot be maintained, for instance, public transit. At this time, I am strengthening this recommendation. I'm strongly recommending that individuals wear a non-medical mask or face covering in indoor public settings when they are unable to maintain a physical distance of 6 feet. This is a strong recommendation, but it is not mandatory. Examples of when masks should be worn in closed public spaces include grocery stores, retail outlets, restaurants, common areas and hotels, public transit, and healthcare settings such as walk-in clinics, physician offices, emergency departments, and physiotherapy clinics. Wearing a mask alone will not prevent the spread of COVID-19. You must consistently adhere to good hygiene and public health measures, and wearing a non-medical mask provides added protection. When worn properly, a person wearing a non-medical mask or face covering can reduce the spread of their own respiratory droplets. Again, it's to protect other people. Non-medical face masks or face coverings should allow for easy breathing, but fit securely to the head with ties or ear loops, maintain their shape after washing and drying, and be changed as soon as possible if damp or dirty. They should be comfortable and not require frequent adjustment, and large enough to completely and comfortably cover the nose and mouth without gaping. Non-medical masks or face coverings should not be shared with others, not impair vision or interfere with tasks, and not to be placed on children under the age of 2 years, not to be made of plastic or non-breathable materials, and not to be placed on anyone unable to remove them without assistance or anyone who has trouble breathing. And in time, we will all become more comfortable wearing a face mask or covering in indoor public places. There are some individuals who cannot wear a mask due to medical conditions, and children under the age of 2 should not wear a mask or face covering. And please do not judge people who are not wearing a mask. In terms of the Atlantic bubble, and I'll focus on last weekend, the first weekend of the bubble, between July 3rd and 5th, a total of 5,719 vehicles crossed the Confederation Bridge. And over that same time period, 794 vehicles came to P.E.I. via the Wood Island Ferry, and 164 people arrived at the Charlottetown Airport. At the Confederation Bridge, we now have 3 lanes to process vehicles traveling to P.E.I., and that's down from 5 lanes on the weekend. We will have more staff and capacity on weekends in anticipation of increased traffic, and we want to avoid long wait times for people coming to Prince Edward Island. And since travel under the Atlantic bubble started, traffic has been flowing smoothly for a number of reasons. Very few people are showing up at the points of entry without a completed self-declaration form. And we anticipated a large number of visitors in the first few days, and I think we were well prepared in terms of logistics and staffing. I'd like to thank everyone involved in our border screening initiative as part of the Atlantic bubble. We've had tremendous support and cooperation from many partners. And I know you know who you are, and thank you all. We continue to update our guidance documents, and I'll just highlight a couple of things where we've had a number of questions. For instance, following review for the playing of brass and wind instruments, we've revised our guidance to a minimum of 6 feet between players, and that's down from 12 feet. But for singing, our guidance remains 12 feet between people who are singing, as well as other forms of vigorous vocalization. Regarding outdoor sporting activities, it is important to remember that gathering numbers include participants, players, spectators, and volunteers. But if someone's in a vehicle watching or transporting players, then that is not included in that number. Single-day tournaments and similar events are now permitted where the total number of people mixing does not exceed the organized gathering limit. It's important that we keep contact tracing to a manageable level in the instance of a positive case. I was asked last week about cinemas, and actually cinemas have submitted operational plans and are able to operate in accordance with current public health guidance. And we are currently reviewing those operational plans from cinemas, and they are likely to open very soon. So at this point, there are relatively few activities that are not able to proceed with modifications. And an update on Operation Isolation. Currently, there are almost 1,000 people in self-isolation in Prince Edward Island, and 5,531 have completed their 2-week self-isolation. And an update on the testing. I mentioned the large number over the weekend, but we have had a total of over 13,300 COVID-19 tests processed, and of course the 32 positives. We appreciate concerns from truckers who want to get tested and the concerns they have with the timing and accessibility. And we are committed to working with any trucker who wants to get tested. We're looking at ways at making it easier for truckers to get tested and are exploring a mobile testing option and hope to have more information about this in the days ahead. Truckers provide a very essential service in our province and will continue to support testing to keep them safe. This weekend was a reminder that as we progressively move through this renewal process, we cannot avoid risks, but we can assess these new risks cautiously and safely and do contact tracing quickly and efficiently and isolate our cases and follow up regularly. A reminder, of course, if you experience COVID-19 symptoms, please call 811 to get tested. I know I've made reference previously to comments that my children have made, and they asked again recently, when will this be over? And when will this COVID-19 finish? I do not know for sure, but I know that we are going through this together. We're working on all the things that we need to do to protect our families, our community. So let us continue to look after each other. Let us be patient and let us be kind. Thank you. I'll turn over to Marion.
Hi, good morning, everyone. It's nice to be back with you again this morning. The Joint Response Team remains at a System Response Level 2 of enhanced monitoring, planning, and limited response. I first want to acknowledge the extraordinary efforts made over these past few days to ensure the quick, safe, and efficient response to the most recent cluster of COVID-19 cases. We saw staff contact tracing, swabbing, and testing hundreds of residents, staff, and close contacts in the COVID-19 testing sites, and our laboratory staff spent long hours providing high-quality results for these tests. Staff and physicians worked hard across the system in all areas to ensure we had the needed capacity in our acute care hospitals to facilitate care if needed. Community hospitals worked hard to facilitate transfers in order to create this capacity as well. As others have said, we expected to see more cases. The preparation and planning that we have spent much time and effort on over the past number of weeks and months was tested over this past weekend. The plans we have performed well, allowing the health system to maintain strong procedures to contain the virus, including the screening protocols, appropriate use of personal protective equipment, contact tracing, and rapid testing. As with any test of a system or a plan, we'll now be looking at how we can perform even better. But overall, our continued readiness to respond to COVID-19 resulted in limited spread of the virus identified so far and a minimal impact to our health services provided to Islanders. It is a reminder that we must maintain this to be COVID ready in the long term. We must maintain our plans and strategies to limit the spread of the virus, even as we continue to provide more services to Islanders. We have scheduling appointments now for specimen collection and diagnostic imaging to maintain physical distance, and the use of virtual care where possible to reduce the volume of people in our care spaces. For the immediate future, we're preparing for the retesting of those who were connected to the Whisperwood Villa contacts for the rest of this week, as noted by Dr. Morrison yesterday. That will be beginning tomorrow. Please be reminded that our healthcare services have not changed since last week, and our facilities remain safe. Please attend your appointments and seek care if needed. I want to offer my congratulations and thanks to the Whisperwood Villa administration and staff for their efforts in working with the Chief Public Health Office and our coordinated services in managing this recent contact tracing and testing. The management and staff's implementation and use of the infection prevention and control measures have supported the safety of their residents and staff. Thank you for your efforts and continued care for the residents within your home. Thank you to all who have contributed: public health nursing, laboratory, our testing and screening clinic staff. Our hospital system has remained responsive as well, and we need everyone as we remain as a system able to respond to COVID-19 while continuing to offer healthcare services safely. Thank you.
Thank you, Marion. And now we'll take some questions.
Karine Fleury, La Voix acadienne.
Oui, bonjour, j'avais une question pour le docteur Morrison en français. Est-ce que vous pouvez me répéter ce que vous avez dit concernant les masques de protection?
Et, bonjour, et je m'excuse que j'ai pas répété. J'avais des grandes choses à dire aujourd'hui, alors j'ai pas répété tout en français. On parle beaucoup des masques pour protéger les autres. Et puis aujourd'hui, c'est pas vraiment juste une suggestion, mais une recommandation de porter un masque non médical pour si vous êtes à l'intérieur et vous pouvez pas garder la distance de 6 pieds ou 2 mètres. Mais il y a quelques personnes qui ne peuvent pas porter un masque si ils ont des conditions médicales ou ils sont 2 ans ou moins. Alors, on ne peut pas juger les autres s'ils n'ont pas un masque. Mais c'est important de laver les mains. Ce n'est pas la seule chose qu'on peut faire pour nous protéger ou protéger les autres. Mais on voit que les cas autour du monde, il y a plus de cas. On a des personnes qui n'ont pas beaucoup de symptômes et peut encore transmettre le virus. Et puis on a appris tellement à propos des masques depuis 2 mois. Alors on comprend maintenant qu'il y a l'évidence de mettre les masques peut faire une différence pour une communauté. Alors c'est pour cette raison qu'à ce moment on annonce d'en faire.
Allison Jenkins, The Guardian.
Yes, good morning. I am noticing Marion encouraging people to attend their medical appointments. Just wondering if there has been an increase in people not showing up for appointments during, even though the services are available and the appointments are still going.
Hi, Allison. We haven't seen that over this past weekend from the most recent cluster of cases that I'm aware of, but it is an offer of reassurance that our processes are working. We do have screening in place and the measures in place to make sure that people can access our services safely. And so we just want to encourage people again. We did see that earlier on in our response, and we know that people are afraid of contracting this virus and coming out into some public places still. With the opening up of our public health measures in our community, I think it's really about just reassuring people that we have the right processes in place. Our plans are working. We're able to keep people safe. We're watching closely for anyone with symptoms of the virus and wanting to make sure that they have access to testing, and that our screening identifies that and puts then safety measures in place for our staff and other patients coming to the clinics or any of our appointments or procedures.
Okay, great. I have been hearing that myself. I was just wondering if it was in response to a bigger issue. And I just have a question about masks, and if a person, so say you wear it out and about for a day of errands and you're protecting yourself, do you just wash it with your regular laundry? Does it need to be extra hot water? Does it need bleach? Is that enough to, kill the virus? Is a regular wash and regular soap enough to, keep it clean enough to be safe?
Allison, so if things to remember when you're out wearing a mask that, I mean, first of all, I just can't emphasize enough how important it is to wash your hands before you put a mask on, wash your hands before you take a mask off, and then again after the mask has been removed. And if it's a reusable mask, then a normal warm laundry will be sufficient if you do a load of laundry and wash it. We're going to make sure that we have updated our guidance about masks, and we're actually having some visual poster that will help, that will be available online as well, that may be useful for people for exactly that kind of reason, to give them some more advice, because it's new for all of us, and it's not something we all necessarily want to do, and it's going to be a change for some of us, and we will get used to it. And again, it's not, you do not need to wear it if you're driving in a vehicle by yourself, or if you're walking down a road outside, but it is for indoor places where you are unable to keep that distance. So it will be uncomfortable for in terms of just getting used to it. But I think, based on what we know and our current understanding, that it's important to do, and we'll expect each other, if we can, to do so.
Great. That's great. Thank you.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Dr. Morrison, question pour vous en français par rapport à l'éclosion qu'on a connue ici avec l'étudiant américain qui voulait venir à l'île du Prince-Édouard. Le premier ministre King disait ce matin à CBC que s'il y avait eu une meilleure communication entre les autorités fédérales et provinciales, ce cas-là ne serait peut-être pas arrivé. J'aimerais vous entendre là-dessus. Est-ce que vous êtes d'accord avec cette affirmation-là?
Bonjour, j'ai pas entendu exactement, mais je sais que c'est important, et sur le site fédéral, si quelqu'un veut entrer au Canada, je sais que c'est là, il faut aussi regarder qu'est-ce que les provinces ont besoin pour entrer aux provinces. Alors, l'information est là. Je pense que c'est aussi une tâche difficile pour la frontière fédérale, et puis il y a beaucoup de monde, mais je pense qu'on a besoin, comme province, de continuer à parler au gouvernement fédéral à propos des frontières. Et j'imagine que le premier ministre King et les autres vont parler. C'est une grande discussion à cause des cas qui augmentent ailleurs.
Au sujet des masques, Dr. Morrison, avec la recommandation plus appuyée que vous faites aujourd'hui, est-ce que vous préparez le terrain à ce que ça devienne éventuellement obligatoire, peut-être un peu plus tard durant l'été ou au début de l'automne?
C'est une bonne question. À ce moment, c'est pas obligatoire. C'est une recommandation, parce que je pense qu'on a beaucoup à faire avec la communication, l'éducation en premier. Et on va aussi regarder qu'est-ce qui arrive à propos de l'épidémiologie du virus aux régions atlantiques et au Canada.
Merci beaucoup.
OK, merci.
Jessica Doria-Brown, CBC.
Hi there, Dr. Morrison. My first question is about your recommendation about masks. Why issue a strong recommendation? Why not make it mandatory?
Actually, that's a great question because I just answered part of that in French, and it's a good reminder to translate it. So it's for part of the reason I think we talked about that not everyone can wear masks, and I think we have a really important role ahead of us in terms of communication and education about non-medical masks and face coverings at this point. So I think we need to do that over the weeks ahead and continue to watch the epidemiology of this virus in the Atlantic Canada, and in an international context.
Okay. And as my colleague just mentioned, I think his question was kind of about might you make it mandatory down the road?
I mean, I think we'll continue to look at the evidence, and some of this is evidence that we have learned and are continuing to learn about, and the basis of making it something mandatory or not, maybe on the strength of evidence that we have. So it will be certainly something we'll continue to look at, and whether we need to make it mandatory at some point is always a possibility if we think it's in the best interest of protecting islanders.
Okay, lovely. And my other question is just why haven't all people who may have been at Whisperwood been tested yet? Are they away? Are they out of the province? Are they unreachable?
Well, actually, in terms of, the residents, there was only one resident who was unable to be tested because of an underlying medical condition, and they have enhanced precautions in place. The staff have all been tested that have been working last week and have come back negative. And the visitors, there were only just a remaining few visitors, and they were just difficult to contact, and we had to try to contact them by email. So the remaining ones we're hoping we'll be able to contact today.
Okay, thank you very much.
Louise Martin, CBC.
Oh, hi there. Good afternoon to you both. Dr. Morrison, I'm hoping just to get some clarification under the circumstances on which the person from the U.S. was turned away from Confederation Bridge. This was the person that flew from the U.S. to Toronto to Halifax. Was he traveling via vehicle alone or with others who then were able to continue on to Prince Edward Island?
So they were the case, the individual in the car from the United States, or who had been in the United States and arrived in Halifax, and was in the car with our case. They turned around together. They were in the same vehicle, and they went back to Halifax.
Okay, so just the one male person in the 20s that came back to Prince Edward Island.
So that's I'm not totally understanding the question, but the vehicle did turn around, went back to Halifax, and then the case from the U.S. did not come to Prince Edward Island.
Right. Yes. I just wanted to clarify that he was with the individual from Prince Edward Island that then came back and sort of started this cluster.
Yes.
Okay. And then I just wanted to get your 2 cents on the letter, the open letter to the World Health Organization. I know that BC's health officer weighed in yesterday talking about this is sort of the controversy over airborne transmission of COVID-19. She seemed to suggest it's been overblown, but I'd love to get your thoughts on what you think on that.
Well, I mean, everything about this virus we've talked about that we've learned in the last 3 months, and we continue to learn. There are more papers and being published at an incredible rate about the virus and different aspects of it. I think what we've seen, it's limited regarding airborne. I think we also have to rely on what we do know from other similar viruses and and go back to our knowledge about the transmission of these types of viruses and when you cough, what happens, and on what those droplets look like, and the evidence around that. The evidence has been certainly that most transmission occurs with close contacts, and I think we need to look at the weight of that evidence. So, but with all of this, Louise, we continue to learn, and we'll watch what happens in the weeks and months ahead.
Thank you very much for your time.
You're welcome, Louise. I think that's everything. Thank you all very much. Have a nice day. It's a beautiful day out there.